Hi everybody, Dr. Jennifer Quammen here. I wanted to jump back in and carry on the conversation around the VPA, the Veterinary Professional Associate. I posted a video 6 weeks or so ago talking about this coming ballot initiative in Colorado. And as it turns out, we've had an election and that proposition did pass by a somewhat small margin, so 52-48, so 4 percentage point range there, or variance, if you will. And why do we want to talk about it now? Well, a few things. I think now that we know this is going to actually happen in Colorado, and this will be the first state in the US, the first jurisdiction in the US that will have this VPA, this Veterinary Professional Associate, I think we really need to be conscientious about putting some rules and regulations that coincide and make sense to protect the public, to protect our veterinary technicians, to protect our educators. There are a lot of stakeholders involved here. And so this has been a pretty hot topic in the profession of late. And some of you may know I was a credentialed veterinary technician prior to going to veterinary school. And so I feel like I'm mostly coming to you with the hat of a veterinary technician on. And so there are a few things that I want to really focus on right now. And that is thinking about what we can do in terms of influencing the rules and regulations before this gets into the actual reality of happening. So in January of 2026 is when this is sort of the go live date, if you will. And so between now and then we have a little over a year to truly write some boundaries, if you will, for what the VPA is going to be able to do. We already know the way it is in statute that this individual will essentially be able to do everything that a veterinarian can do outside of prescribing. And prescribing is a little bit different because that's sort of mandated on the federal level. And so that would require a change from like the FDA for that to kind of be edited. And so I want you to envision a world where everything is going great. And in that land, we have enough veterinary technicians for all of our veterinarians to work to their full capacity. And in most small animal situations, we know that that number of technicians or assistants per veterinarian to be most efficient, most effective is around 3, at least in the small animal sector, which is where the VPA is going to be impacting. And I expect that the VPA is going to probably need a somewhat similar portion of veterinary technicians and assistants to support them. And so if we look at the numbers that are out there right now, just in terms of who's graduating from schools, how many people are in each of those sectors of the profession, we already don't have a great retention with our veterinary technicians in terms of having enough of them available to truly help our veterinarians become as efficient as they need. And so when I think about this for the VPA, that is one thing I really want to hone in on is what is this going to do to impact our veterinary technicians? I don't think there's been enough language here around that. And I would also like to point out that this program that Colorado State is putting together in conjunction with this proposition passing is a master's level degree. And so that requires individuals who are applying to the program to have a bachelor's degree. There's been language initially that this was going to be a stepping stone or a way to elevate our veterinary technicians into a different role. But as things have changed over the few years when this was attempted to go through the Colorado legislative process and then essentially came down this path of a ballot initiative, things of course have changed. And so now this is not an individual that is required to be a veterinary technician prior to going into this program, but they are someone that's required to have a bachelor's degree. If we look at our working veterinary technicians out there in the country, we know that about 75 to 80% of them have an associate's level degree, and so they don't qualify for entry into this program. There is a somewhat similar program, it's a little bit different, that is happening at Lincoln Memorial University that's based in Tennessee. But that program is a master's in veterinary clinical care, and it does require a bachelor's degree and for that individual to be a credentialed veterinary technician. So slightly different program, but I want to refocus us in thinking about Colorado and thinking about the wider image of what this is going to be. So I don't think we've really thought about our technicians and thought about how we could actually support them. And for me, the ground level way to support them is for veterinarians and the rest of the public to really support and see them as their own profession, for them to be able to say, here are the things that I can do that I don't need my veterinarian to have to do. It requires us as veterinarians to step back a little bit and let go of the reins and allow and trust in our people who are credentialed to do those tasks. And in some states, you can even do this with someone non-credentialed. Again, there are multiple states right now that we don't have a credentialing capability for even our veterinary technicians. And so I would love us to take a big step back and say, okay, rather than blowing up this profession and really creating a potential division that we may never be able to come back from the precipice of, how about we actually say, how can we influence the jurisdictions that we work in North America and in the United States, obviously, is where my brain primarily focuses. How do we actually support our technicians in getting them the recognition they deserve and getting them a credential within each of their jurisdictions? There are lots of other states that have done it. Minnesota just passed this, I think in 24, that this is just now able to happen in Minnesota. And that's a state where this conversation has been happening for literally decades. When it comes to the VPA, so I'll cycle back. I'm going to try not to go tangent too long, but tangent 1 is thinking about our veterinary technicians. Tangent 2 for me is thinking about the public and how we protect the public. When you are a veterinarian, and in most jurisdictions as a veterinary technician, you pass your classroom work, you graduate from school, you then take a national licensing exam. For veterinarians, that's the NAVLE, and for veterinary technicians, that's the VTNE. And once you've passed that, then you can apply for credentialing in your individual jurisdiction. There's often a state exam associated with that as well. There are fees you have to pay. There is required continuing education every 1 to 3 years, depending on the state. And there are all kind of nuances that allow you to continue to have the privilege to practice in that capacity as a veterinarian, as a veterinary technician. We don't have that when it comes to the VPA. And I think the reason that's important is if something happens to a patient that is owned by a member of the general public, they have no recourse. You know, who can they go and say, this was malpractice, something happened, my animal was injured? Well, they don't have the ability to do that with the VPA because this individual does not have a credential that they're going to be working into. And so the person ultimately responsible is the veterinarian. And in some scenarios, that might be awesome, right? These might be, and this is not about the individual person. This is just about the scope of how this has been laid out and how this was sort of brought to the public. And again, there are a lot of forces at work that really would like for the veterinary profession to just continue fighting with each other so that they can take advantage of the market opportunity that's there. Again, sidebar that I'm not going to go too much into today, but how do we protect the public? That is important to me. How do we protect those patients? And how do we ultimately protect our veterinarians as well? So I think our technicians, I think our general public and our animal patients, and I think our veterinarians are 3 different stakeholders that we should really be considering here. The VPA is going to have essentially half of the time in training that a veterinarian has, but able to do the exact same, at least as it's been proposed, the same degree of procedures in terms of surgical procedures. They're going to be able to prognose, they're going to be able to diagnose, they're going to be able to perform surgeries. And this isn't just like a simple little, you have a wound that needs to be clipped and cleaned and maybe a stitch or 2. We're talking major abdominal surgery, spays. We're talking about removal of organs like a splenectomy. We're talking about potential removal of a digit or a limb like amputations or part of a tail. Those are things that are not, just simple surgeries, right? Like we all know that what a client sees on the outside is that skin incision on the abdomen, but there's a lot of anatomy, a lot of physiology, a lot of things that you need to know about infection control and pain control that are really important to get a successful outcome with a surgery like that. I'm concerned the VPA is going to be they're going to be put in a position where they're not going to have the knowledge base to respond when something actually happens. Again, the proponents will say things like, we know that veterinarians are ultimately going to be responsible for the VPA, and this is that third, leg of the stool, if you will, that I really want to think about. And that is, how do we influence this from a veterinarian standpoint? We have the opportunity now to say, how many VPAs can an individual veterinarian oversee? Is that going to be 50? Is that going to be infinity? Is that going to be 1 or 2? Are those people going to have to work in the building at the same time? Are they going to have to work the same shift? Does the VPA have to have a particular amount of training on the job after graduation before they're allowed to go in and do solo procedures? These are things that we really want to think about right now. The final thing associated with the veterinary side is supervision. And so we've clarified this in most states. It's not perfect in every single state for our veterinary technicians and assistants, but this idea of supervision, in most jurisdictions, we have 3 levels. So we have immediate, meaning like veterinarian and the veterinary technician are side by side. And so what would that look like in the case of a VPA? We have direct, meaning if I, as a veterinarian, am overseeing a technician doing something, I just need to be in the immediate vicinity, like someone can go get me out of the next room or even in that same room. And then we have indirect, which is you may not even be on site as the veterinarian. So I've left, for example, standing orders on how we treat XYZ condition, and I can be reached by phone or some other electronic means, but I'm not specifically there in real life. This is where I think the rubber meets the road really with the VPA. So you can imagine a world where, if left unchecked, a single Colorado licensed veterinarian could be responsible for multiple VPAs. They may not be in the same building, they might be on opposite ends of the state, or perhaps if this is a Colorado veterinarian, but we don't clarify that they have to be in Colorado, maybe they're on vacation somewhere in the Caribbean, or they're working on the other side of the world, which is great. I'm happy for folks to do that, but does that still allow you as the veterinarian to be properly supervising someone that's doing a procedure on a patient thousands of miles away? These are the things that we need you to really talk to your legislators in Colorado. I want you to talk to your legislators in whatever jurisdiction you're in, because this conversation has been happening for a few years. It's gotten a lot more traction this year, obviously. It has been in Florida before. It will be coming back to Florida in 2025 and potentially years beyond that. And there are probably at least a dozen or so jurisdictions where this conversation is going to be happening in the coming 1 to 5 years. And so now is the time. Colorado is sort of the tip of the spear in terms of the states that are going to have a VPA. I think in terms of ability to protect our veterinary technicians, to protect the general public and those patients, and to protect the veterinary profession, and truly to protect this human-animal bond that is the reason we're all in this profession, it is imperative for us now to really figure out what those levels of supervision look like, what those procedures these individuals can do are, and how much training, how much overlap they need to have on the schedule. Again, does a veterinarian need to be in the building? What if you hired a veterinarian, you hired as a veterinarian, you hired a VPA, and then the veterinarian chooses to leave that job? Does that mean the VPA can't work now? Or does that mean they have to find someone else? Or how do you sever that, that relationship of supervision? How do you make sure both parties agree to it? These are all those little nuanced details that are really important for us to think about right now. So I'm not going to spend today getting into all the depths in terms of the finances and the financial reasons this is happening. Those conversations can be a follow-up, or if you have questions, I will happily dive into that as well. Again, Jennifer Quammen coming to you as a veterinary technician and currently as a veterinarian to say, we really need to be thinking about what this VPA is going to mean to this profession. And in terms of the individuals in this profession, that to me includes our front desk team. It includes our practice managers, office managers, our veterinary technicians and assistants, our veterinarians, and the students in all of those programs as well. So how will this impact you? Hopefully you've learned a little bit from this. And if not, I want to know what your point of view is and how we can truly work together as a united team, rather than dividing us apart, because that's not, we're a small profession. It's helpful for no one if we're just battling each other from different angles. And so let us work together. Let us think about the future of this profession. Let us get those patients seen, but let us do it in a way that is safe and is not being done with just the wallets as the main point of focus, if that makes sense. So with that, if you want to find out more about who supported this proposition, who didn't support this proposition, you can refer back to my previous video. You can also find out who paid for campaigns in the pro and the con on Colorado's websites. Their state website will share that with you. And I want to know what you're thinking. What's your role in the profession? Are you a spectator? Are you a pet owner? Are you a farm owner? Do you have livestock? How is this going to impact you? And what do you want to see come from this profession? And how can we now, moving forward, say what can a VPA truly have the ability to do? Because if we start with the barn doors wide open, we're never going to be able to get those back. And so we really need to think about ways to thoughtfully move ahead and maybe down the road actually invite this into a bigger conversation. So with that, I'm looking forward to hearing from you, and I hope you're having a great day no matter what you are doing. And thank you for spending a little time with me today. I'll be in touch soon.